Hi everyone, my name is Souhyb Al-Btoush, a nursing student at the University of Jordan, and today I will be presenting a biochemistry focused topic that is highly relevant to nursing practice: malnutrition and the nutritional assessment. This presentation was prepared under the guidance of Dr. Muhammad Al-Wahshi from the Faculty of Nursing. We will explore how biochemistry helps us understand and manage malnutrition in clinical settings. Let me give you a brief overview of what we will cover in this presentation. We will begin by defining what a nutritional assessment is and how it relates to malnutrition. Then we will examine the causes and types of malnutrition, followed by the role of albumin as a biochemical nutritional marker. Next, we will explore how nurses perform nutritional assessment and the common tools used to screen for nutritional status, including anthropometric measurements. And finally, we will wrap up with a summary of the key points. Each section is supported by evidence from highly credible sources, such as the World Health Organization, the National Institute for Health and Care Excellence, and the European Society for Clinical Nutrition and Metabolism. This ensures the highest level of scientific accuracy and the clinical relevance to nursing practice. Let's first define what malnutrition actually means according to the World Health Organization. Malnutrition is a condition that results from a deficiency, excess, or imbalance in the intake of energy or nutrients. This means that malnutrition includes not only undernutrition, where individuals don't get enough essential nutrition, but also overnutrition, which involve excessive intake, leading to problems like obesity. Now, why is nutritional assessment is important, especially in clinical practice? Because early identification of malnutrition can significantly improve patient outcome, reduce the risk of complication, and shorten hospital stays. Unfortunately, malnutrition is often underdiagnosed, particularly among hospitalized patients and the elderly. This is why nutritional screening and assessment must be a routine part of nursing care to ensure early intervention and better recovery. Now, let's explore the main causes of malnutrition, which can result from a variety of physiological, pathological, and social factors. First, we have inadequate nutritional intake. This is especially common among hospitalized patients, elderly individuals, and those suffering from poor appetite due to illnesses or medication side effect. Second, malabsorption syndrome. These are medical conditions where the body cannot properly absorb a nutrient. Examples include Crohn's disease, celiac disease, or patients who have undergone gastrointestinal surgery. Third, increased metabolic demand. In situations like severe infections, burn, trauma, cancer, or a chronic disease, the body need for a nutrient rises dramatically. If the demand is not met, it can quickly lead to malnutrition. And finally, socioeconomic and psychological factors. Issues like poverty, neglect, depression, or eating disorder can significantly interfere with a person's ability to obtain or consume adequate nutrition. Understanding these causes helps us as nurses to identify at-risk individual and tailor intervention accordingly. Types of malnutrition. Malnutrition is not a single condition. It can take several forms, and understanding these types is essential for accurate nursing assessment and intervention. First, we have undernutrition. This includes wasting, stunting, underweight. Wasting, which refers to low weight for height and often indicates acute malnutrition. Stunting, or low height for age, typically resulting from chronic malnutrition. underweight, which is low weight for age and can reflect both acute and chronic condition. Second, micronutrient deficiencies. These occur when a person lacks essential vitamins and minerals. Common examples include iron deficiency, which can cause anemia, vitamin A deficiency leading to vision problem, and zinc deficiency, which affect immune function and wound healing. Third, protein energy malnutrition, also known as PEM, protein energy malnutrition. This includes two classic syndromes, marasmus, kwashiorkor. Marasmus, which results from severe calorie deficiency and leads to significant wasting of fat and muscle tissue. Kwashiorkor, which is due to inadequate protein intake, often characterized by edema and enlargement, liver and skin and hair changes. As nurses, recognizing the type of malnutrition can guide our care plan, whether it involves dietary intervention, supplementation, or referral to a dietitian. Albumin as a nutritional marker. Albumin is commonly used in clinical setting to assess nutritional status, but it's important to understand both its value and its limitation. First, what is albumin? Albumin is a major plasma protein synthesized by the liver. It plays a crucial role in maintaining oncotic pressure and serves as a carrier for hormones, drugs, and fatty acid in the bloodstream. Second, how does albumin relate to nutrition? A serum albumin level below 3.5 grams per deciliter may suggest malnutrition. Low albumin is associated with delayed wound healing, increased risk of complication, and longer hospital stays. However, with a half-life of approximately 20 days, albumin is not a reliable marker for detecting recent or acute nutritional changes. Third, and most importantly, we must understand the limitations of albumin as a nutritional marker. Albumin levels can be influenced by non-nutritional factors such as inflammation, liver disease, kidney disease, and the changes in fluid balance. Therefore, albumin should not be used as a standalone indicator of a nutritional status. It must be interrupted in context with a full clinical assessment and additional markers like pre-albumin and C-reactive protein CRP to give a clear picture. As nurses, this understanding helps us avoid misinterpreting lab value and ensure a more accurate nutritional assessment for our patient. Nursing nutritional assessment. Nurses play a vital role in a nutritional assessment and in identifying patients at risk of malnutrition. Why is this important? Because nurses are often the first healthcare professional to notice suitable sign of malnutrition during daily patient interaction, whether it's reduced appetite, weight loss, or poor wound healing. Additionally, our continuous and close monitoring of patient gives us a unique opportunity to detect early changes in a nutritional status. This allows us to initiate timely interventions, refer to dietitian, and collaborate with the healthcare team to improve patient outcome. In a sense, the nursing role in a nutritional assessment is not just supportive. It is essential for prevention, early detection, and the overall management of malnutrition. Common nutritional screening tool. When it comes to evaluating nutritional risk, there are several validated screening tools that nurses can use effectively in different clinical settings. First, we have the Malnutrition Universal Screening Tool, commonly known as MUST. It assists three main components: body mass index, BMI, unintentional weight loss, and the effect of acute illness on nutritional intake. It's designed for adult and is quick and easily to use in hospitals, clinics, or community settings. Second, the Many Nutritional Assessment or MNA. This tool was specifically developed for older elderly. It combined dietary questionnaire with physical assessment to evaluate nutritional risk in the elderly, who are particularly vulnerable to malnutrition. Third, we have the Nutritional Risk Screening Tool from 2002, known as NRS 2002. It's primarily used in hospitalized and is recommended by international nutrition societies. It helps identify patients who are already malnourished or at risk, and it guides healthcare professionals in planning appropriate nutritional intervention. As nurses, knowing how to use this tool allows us to detect malnutrition early, monitor changes, and contribute activity to improving patient outcome. Anthropometric measurements are essential tool in nutritional assessment because they provide objective, quantifiable data about an individual's nutritional status. These measurements help us detect different form of malnutrition, whether it's undernutrition, overnutrition, or abnormal growth pattern. They are particularly valuable in both clinical and public health setting. Let's take a closer look at the key indicators. 1. Mid-upper arm circumference, MAUC, is widely used especially in children. It's fast and reliable method to identify acute malnutrition. 2. Height for age reflect long-term nutritional status and is a key indicator of stunting or chronic malnutrition. 3. Weight for height is used to diagnose wasting, a severe form of acute undernutrition. 4. Body mass index, BMI, is commonly used in adults to classify nutritional status as underweight, overweight, or obesity. 5. Triceps skin fold thickness, TSF, estimates body fat and helps assess energy reserves. These measurements allow healthcare providers to monitor changes over time and implement targeted nutritional intervention. As nurses, understanding and applying these tools enhance our ability to deliver precise, evidence-based care and contribute meaningfully to the fight against malnutrition. In conclusion, nutritional assessment is not just a clinical task. It is a vital responsibility that empowers nurses to detect malnutrition early, support recovery, and improve health outcome by combining a clinical observation with evidence-based tool. We can ensure that no patient nutritional needs go unnoticed. Together, let's continue to advocate for nutrition as a cornerstone of quality care. And thank you very much for listening.